Alright, so this skill is for your Pediatric Respiratory Compromise skill station. And like normal, you come in, they'll give you, introduce themselves, and then they will give you a set of instructions. So those instructions are going to be this progressive skill or skills are designed to evaluate your ability to provide immediate and aggressive ventilatory assistance to a 1-year-old child in respiratory distress. No other associated injuries are present. This is a non-trauma situation. Surgical precautions are not necessary. You must actually perform all assessments and interventions that you feel are necessary. If you choose to ventilate the mannequin with a BVM, you must do so for at least 1 minute. I will serve as your trained assistant and will be interacting with you throughout the skill. I will correctly carry out your orders upon your direction. Do you have any questions? Right, then they'll tell you to take 2 minutes, check your equipment, and prepare whatever you feel is necessary. So you want to make sure you've got something to deliver some blow-by. You want to make sure you've got a BVM, an appropriate size BVM. You want to make sure you've got OPA, NPA, and whatever else you may need to insert that. You want to make sure that you have something to pad behind their shoulders. I've got a little device here I'm going to use, but you want to make sure you've got something there, okay? Then they will, once you're ready, they will give you your information. You may want to have a stethoscope, whatever. Right, they'll give you information. So you're going to a residence for a sick child who has difficulty breathing. All right, they'll tell you it's safe, and the patient usually will be sitting in somebody's lap. Now, I don't have another somebody to put their lap in, so we're going to pretend that right here, sitting up against the wall, that they're in somebody's lap. That helps visualize it. So the first thing we're going to do, of course, is PPE, proper PPE. Right, then we're going to get our impression, our general impression from a distance before we approach or touch the patient. This is really important with pediatrics because if you get some strange person coming in right at them, they're probably going to freak out and it's going to make it worse. So we don't want to do that. So we want to get this approach before we approach them, before we touch them. We're going to look and see what's their level of consciousness. We're going to assess that airway. We're looking for any kind of foreign bodies, any kind of obstructions, any secretions, any audible noises, funky sounds, anything that could be causing this breathing problem. Then, once we've looked at the airway, determined whether it's patent or not, we're going to look at the breathing. So we're looking at rate, rhythm, and quality, and chest movement, and any breath sounds here, okay? Then we're going to put a pulse ox on. I don't have one, so we're going to pretend pulse ox. All right. Then we're going to see what that is, and they're going to tell you that the pulse oximeter shows a saturation of like 82%. Well, we know that's bad. So now we have to get them some oxygen. So we're going to prepare our selection. We're going to do some blow-by at this point and see how this helps the baby. All right, so we've got a little mask here. We're going to hook it up to oxygen. We're going to put it on maybe 10. And we're going to have mom. All right, mom, because we're going to use mom if possible, or dad, whoever it is. Let them help you. They can help usually with the baby more than, and the baby will allow them to do more than they would allow us to do without, making the baby worse. We're going to take this, we're going to kind of hold it, and we're just going to kind of wave it in front of their face a little bit. We're going to oxygenate that extra air, or the air that they're breathing in, okay? So then we're going to let them do this. While they're doing the blow-by, okay, we're going to check a pulse. So 1 year old, we're going to check brachial. All right, so we check the brachial pulse. We're going to look at perfusion, skin color. We're going to look at their capillary refill, checking on the feet or the hands as needed. All right, condition and color. Is it dry? Is it cool? Is it pale? What does it look like? Then we're going to get our baseline vitals. Now at this point, they're going to say that they're getting worse. Their SpO2 is dropping, their pulse rate is dropping, their respirations are getting irregular, their head is bobbing, they're getting really drowsy. All right, so that's our cue that they're getting worse. So this blow-by is no longer working. We've got to move to the next step. So we're going to take this. All right, mom, we need to help him breathe a little bit more. So I'm going to take him and we're going to lay him down flat, okay? All right, so we're going to now lay him down flat here. Now, if you look and see, like, their heads are proportionally a little bit bigger. All right, so it tends to kind of put their airway in a little bit of a bind. So you want to make sure that you are going to manually open to a sniffing position and that we have padded underneath the shoulders as needed to maintain that open airway, okay? Open the airway. We're going to look at an airway adjunct. You could do OPA. If you do an OPA, make sure that you use a depressor blade or a tongue blade to actually move the tongue out of the way. If you do, it was a little bit big. If you do a NPA, make sure that you insert it appropriately. Okay, all the way in there we go. Now we are going Make sure that airway is still open. Got a good seal here. All right, they're going to say there's no gag reflex. They accept the airway adjunct, and their rate's 20 minutes. Now we're going to assist with that volume. So we're going to properly pad. We're going to ventilate. Okay, 12, got oxygen hooked up and flowing, 12 to 15 liters per minute. And now we're going to get a good tight seal to the face and ventilate. 1 Mississippi, 2 Mississippi, 3 Mississippi, squeeze. 1 Mississippi, 2 Mississippi, 3 Mississippi, squeeze. 1 Mississippi, 2 Mississippi, 3 Mississippi, squeeze. 1 Mississippi, 2 Mississippi, 3 Mississippi, I can't talk anymore, squeeze. And so on. You'll do this for 1 minute. Okay, so now we're going to ventilate at the appropriate rate and volume, approximately 20 a minute, with adequate rate, adequate depth. We want to see chest rise and fall. And we're going to look for any changes in capnography, colorimetric. Ideally, we would see their level of responsiveness improve. We would see their pulse rate come up. We would see their pulse oximeter improve. If you don't tell them this, they may ask you, or they may ask you again, how would you know if you're ventilating the patient properly? Well, all the things we just said. Our colorimetric would be good. Our pulse ox would improve. Our level of responsiveness would improve. Everything would get better. And then, of course, we're not going to stay on scene with this. We're going to transport, so then we're going to call for immediate transport of the patient. And done.